Cancer is one of the most feared diagnoses in the world. And when someone hears the word cancer, one of the very first questions they often ask is about food, specifically sugar. You may have heard people say, "Sugar feeds cancer," or "If you stop eating sugar, cancer will stop growing." These statements are everywhere online, and they can create confusion, fear, and guilt, especially for people already facing a cancer diagnosis. But what do doctors and cancer researchers actually say about sugar and cancer growth? What is scientifically true, and what is misunderstood? Today, we are going to calmly and clearly explore this topic, using real medical knowledge, without fear, without exaggeration, and without false promises. Cancer is complex, nutrition is complex, and sugar, despite being a simple molecule, plays a very complicated role in the human body. Understanding this properly can help patients feel more informed, more empowered, and less overwhelmed. This video is not about blame or restriction. It is about clarity, science, and realistic guidance. To understand the relationship between sugar and cancer, we first need to understand how the body normally uses sugar. Sugar, or glucose, is one of the primary energy sources for every cell in the human body. Your brain, your muscles, your immune system, and even your healthy cells depend on glucose to function. When you eat carbohydrates, whether from fruit, vegetables, grains, or sugar itself, your body breaks them down into glucose. This glucose enters the bloodstream and is either used immediately for energy or stored for later use. Cancer cells, like normal cells, also use glucose for energy. This fact is often at the center of the claim that sugar feeds cancer. But this statement is incomplete and often misleading. According to oncologists and medical researchers, all cells need glucose, not just cancer cells. If you were to completely remove sugar or glucose from the body, healthy cells would suffer just as much as cancer cells. In reality, it is not possible and not safe to starve cancer cells of glucose without also harming normal tissue. Doctors often explain that cancer cells do tend to consume glucose at a higher rate than normal cells. This is known as the Warburg effect, a phenomenon observed by scientists nearly a century ago. Cancer cells rely heavily on glucose and use it in a less efficient way to produce energy. This is actually how PET scans work. In these scans, a form of radioactive glucose is injected into the body, and areas with high glucose uptake, such as tumors, light up on the scan. This confirms that cancer cells use glucose more aggressively, but it does not mean that eating sugar directly causes cancer to grow. One of the most important points doctors emphasize is that eating sugar does not directly make cancer cells grow faster in isolation. Cancer growth is influenced by many factors, including genetics, inflammation, hormones, immune system function, and the tumor's biological characteristics. Sugar intake alone does not act like fuel poured onto a fire. The body tightly regulates blood sugar levels, even when someone consumes sugar. This regulation happens through hormones like insulin and glucagon, which keep glucose within a relatively narrow range. However, doctors also clarify that while sugar itself does not directly cause cancer growth, chronic overconsumption of sugar can contribute indirectly to conditions that increase cancer risk. Excessive sugar intake can lead to weight gain, obesity, insulin resistance, and chronic inflammation. These conditions are associated with a higher risk of developing certain cancers, including breast cancer, colon cancer, pancreatic cancer, and liver cancer. This connection is indirect, but it is supported by strong scientific evidence. Obesity, in particular, plays a major role. Fat tissue is not just a storage site for energy. It is biologically active. It produces hormones like estrogen and inflammatory molecules, that can influence cancer development and progression. In breast cancer, especially hormone receptor-positive breast cancer, higher estrogen levels are linked to increased risk and recurrence. Excess sugar consumption can contribute to weight gain, which in turn may affect hormone levels and inflammation. Doctors also talk about insulin and insulin-like growth factor, known as IGF-1. When people consume large amounts of refined sugar and highly processed carbohydrates, blood sugar spikes occur more frequently. This can lead to higher insulin levels over time. Insulin and IGF-1 are growth-promoting hormones, and elevated levels have been associated with increased cancer risk in some studies. Again, this does not mean sugar directly feeds cancer, but it shows how metabolic health matters in cancer prevention and survivorship. Another area doctors address is the difference between natural sugars and added sugars. Natural sugars found in whole fruits, vegetables, and dairy products come packaged with fiber, vitamins, minerals, and antioxidants. Fiber slows down glucose absorption, helping to prevent sharp blood sugar spikes. Numerous studies show that diets rich in fruits and vegetables are associated with lower cancer risk, not higher. This is why oncologists do not advise cancer patients to avoid fruit out of fear of sugar. Added sugars, on the other hand, are sugars added during food processing, such as those found in sugary drinks, candies, baked goods, and ultra-processed foods. These foods are often calorie-dense and nutrient-poor. Doctors consistently recommend limiting added sugars, not because they directly cause cancer growth, but because they negatively affect overall metabolic health. When it comes to cancer, patients actively undergoing treatment, doctors take an even more nuanced approach. During chemotherapy, radiation, or recovery from surgery, the body needs energy and nutrients to heal. Strictly eliminating sugar or carbohydrates can sometimes do more harm than good. Patients may experience weight loss, muscle wasting, fatigue, and weakened immunity. Oncologists and oncology dietitians often emphasize adequate nutrition over restriction, especially during treatment. Some patients ask about ketogenic or very low carbohydrate diets and whether these diets can starve cancer cells. Doctors acknowledge that this area is being actively researched, but they are careful. While some early laboratory and animal studies suggest that certain tumors may respond differently to low-carbohydrate environments, large-scale human clinical trials are still limited. At this time, most cancer specialists do not recommend extreme dietary changes without medical supervision. Importantly, cancer is not a single disease. There are over 200 types of cancer, and even within one type, tumors can behave very differently. What might influence one cancer subtype may have no effect, or even a negative effect, on another. This is why doctors strongly caution against one-size-fits-all dietary rules found online. For breast cancer, which affects millions of women worldwide, research suggests that maintaining a healthy weight, stabilizing blood sugar, and reducing chronic inflammation may support better outcomes. Diets that emphasize whole foods, vegetables, lean protein, healthy fats, and limited added sugar are often recommended. This approach supports overall health without creating fear around specific foods. Doctors also emphasize the psychological side of nutrition. Fear-based messages about sugar can lead to guilt, anxiety, and disordered eating patterns. Stress itself affects the immune system and overall well-being. Cancer care today recognizes that mental and emotional health are just as important as physical treatment. Nutrition should support life and strength, not fear and punishment. Another key point doctors make is that cancer cells are very adaptable. Even if glucose availability changes, cancer cells can switch to other fuel sources, such as amino acids or fats. This adaptability is one reason cancer is so difficult to treat. It also shows why simplistic ideas like "just cut sugar" do not reflect the reality of cancer biology. When researchers study populations over time, they consistently find that cancer outcomes are influenced by overall lifestyle patterns rather than single nutrients. Physical activity, sleep quality, stress management, social support, and access to medical care all play significant roles. Sugar intake is one piece of a much larger puzzle. Doctors also highlight the importance of individualized care. What is appropriate for one patient may not be appropriate for another. Factors such as cancer type, stage, treatment plan, body weight, metabolic health, and personal preferences all matter. This is why many cancer centers now include oncology dietitians as part of the treatment team. In recent years, integrative oncology programs have grown significantly. These programs combine conventional cancer treatments with evidence-based lifestyle and supportive therapies. And you are not doing something wrong by eating. Nourishment is not the enemy. Knowledge, support, and compassionate care are some of the strongest tools we have. Cancer research continues to evolve, and today is one of the most hopeful times in history when it comes to cancer treatment. New therapies, better supportive care, and deeper understanding of cancer biology are improving outcomes every year. Nutrition plays a supportive role in this journey, and when guided by science, it can help patients feel stronger and more informed. If you found this explanation helpful and calming, and if you value science-based, respectful cancer education, please consider subscribing to the channel. Subscribing helps us continue creating educational videos that support patients, families, and caregivers with clarity and compassion. Thank you for being here, and we look forward to supporting you in future videos.